Hello, guys, welcome to the second episode of question and answer session with Dr. Amaka. Today, we have an exciting topic. Somebody requested I speak about family planning, the use of contraceptives, the ideal contraceptive, quite broad, but I'll try to simplify it the best way I can. So, family planning is simply deciding when you want to have children, if you want to have children. Yes, it entails the use of contraceptives. And although called family planning, it's not for married couples alone. Anybody that has achieved puberty and is sexually active can use family planning, including minors. Yes, I said so. I know some people that are watching this video would say, why would you allow minors to access contraceptives without parental consent? They play. Teach them abstinence. Yes, 100%. You teach minors abstinence, but you also need to teach them that they can prevent pregnancy and teach them how to prevent pregnancy. Countries like South Africa, for example, from the age of 12, girls are allowed to access contraceptives without parental consent. In Nigeria, unfortunately, we don't really have laws like that, but health workers usually use their discretion, which could be influenced by social norms, religious norms, or cultural norms across the country. The goal of family planning is for you to decide when you want to have children, to prevent unwanted pregnancies, to help you space childbearing in a way that is healthy for you and your baby. WHO requires that you wait at least 2 years before getting pregnant after your previous delivery, or 6 months if you had a miscarriage or an abortion. Family planning involves the use of contraceptives to prevent pregnancy. And a lot of people ask, what is the ideal contraceptive? The truth is, there is no ideal contraceptive. It depends on you, your medical history. What is good for Bimbo may not be good for Amaka, and vice versa. But if you want to know the most effective contraceptive, that will be the implants. It has the highest success rates. The least effective will be the spermicide, the withdrawal, the use of calendar. Calendar has a failure rate of about 24%, so it's quite high. Now let's talk about the contraceptive methods. You have a lot of contraceptive methods, but I'll start with the barrier method. The barrier method is a form of contraceptive that uses physical or chemical barrier to prevent pregnancy. So I'm talking of condoms, female condoms, cervical caps, diaphragm, etc. The unique thing about condoms is that it can prevent STI. It is the only contraceptive method that can prevent STI, but not as effective as the implants, the IUDs, for example. It has a failure rate of about 13%. So if your sole aim is to prevent pregnancy, you shouldn't use condoms alone. The next contraceptive I'll talk about is the hormonal contraceptive, which is the use of pills. You have two main pills. You have estrogen and progesterone pill, that's the combined pill, and you have the progesterone only pill. Now, there are some people who can't take the combined pill, that is the pill that contains estrogen and progesterone. People who have a previous history of heart attack, people who have a previous history of stroke, people who have a previous history of blood clotting in their body cannot take the combined pills. And women who just delivered, especially during your postpartum period, that's your first 6 weeks, you can't take the combined pills because there's a risk that blood clot can form in your body. Now, women who are breastfeeding are advised not to take the combined pills too because of the estrogen. Again, the estrogen can reduce your milk production. So you might want to opt for a progesterone only contraceptive if you just delivered. The advantage is that it reduces your menstrual cramps, it reduces your menstrual bleeding, but you have to take it every day, including the combined pills too has to be taken every day. With the hormonal method of contraceptives, you have to take them every day. So this could be exhausting and you might forget, which would now decrease the effectiveness of the method. Now let's move on to the injections. That is the depot. Usually taken every 3 months. So unlike the pills, you don't have to take it every day. Now, with the injections, there've been a record of weight gain, about 2 to 5 kg a year in women that take the injections. But this could be controlled with diet and exercise. But if you have a problem with weight gain, so you might want to opt for other methods of contraceptives. The implants are the most effective contraceptive. They have a failure rate of less than 1%. Very effective. They could last for 3 to 5 years. It depends on the implants you use. It's usually put in the arm. Regarding the implants, the research about weight gain is mixed, but generally it doesn't really cause weight gain. And even if you feel you're gaining weight, you can't control your weight with diet and exercise. Regardless of you being on contraceptive or not, you should be controlling your weight regardless. The next contraceptive I'll talk about is the intrauterine device, the IUD. You have two types of IUDs. You have hormonal and the copper IUD. I know a lot of you are familiar with copper IUD. With the copper IUD, it is also an emergency contraceptive, yes. So it's not just postnatal, and it's actually the most effective emergency contraceptive. Yeah, you can use it up to 5 days after sexual exposure. Now, there are some people who we can't fix the IUDs for. People who have an untreated STI can use the IUDs. You have to treat yourself first, because when you are putting in the IUD into the womb, you could transfer the STI to the womb, which could lead to a PID. So that's why I would say IUDs, we kinda prefer it for couples who are in long term, serious, committed relationships. Now let's move over to the natural method. We're talking about withdrawal method, which is not as effective as the implants or IUDs. The calendar method, that is when you know your fertile window and you avoid intercourse with your partner during that period. Not as effective. And you have the lactational amenorrhea method. This is a temporary method used to prevent pregnancy by postpartum women using exclusive breastfeeding to suppress ovulation. It is actually quite effective, very effective when done properly. It has a success rate of 98%. But it has to be done properly. You have to meet the criteria. And the criteria is one, you must be exclusively breastfeeding. I didn't say exclusively on breast milk. I said exclusively breastfeeding. This means that you can't be pumping, you can't be using bottles, no formula, no water, nothing. Your child is only sucking on your breast. You're always putting baby to breast. That is exclusively breastfeeding. Two, your baby is less than 6 months, because once your child starts taking solids, the amount of time they spend on the breast reduces. Three, your period has not returned. If you meet the criteria, this method is actually a temporary method to prevent pregnancy in postpartum women. Highlight on temporary, because after 6 months you can't use it again. Once your baby stops breastfeeding, it is not as effective anymore, because your baby is spending less time on your breast. Okay, we've come to the end of our question and answer session with Dr. Amaka. I hope I was able to answer all your questions. And keep rolling in with the questions. We are always more than happy to answer all your health questions. Until next time, take care of yourself, stay healthy, and goodbye.